Okay, we'll start. That's what I was telling that being like availability of treatment, only 10% of people are receiving this treatment for the opioid overdose. So this is also one of the key factor to increase the mortality due to this kind of overdose. Okay. Then one more thing, like due to their pharmacological effect, opioids in high doses can cause respiratory depression and death. Okay, so this is what I try to explain in the initially. Like once they got the resistance, okay, so there is an increase, and all those increase in the dose. Okay, so what will happen due to their main pharmacological action on the respiration rate? So they may lead to the decrease in the respiration, and there will be a like suddenly decrease in the number of the breathing and all those things. So it may lead to the respiration depression or respiratory failure. Okay, so this again may lead to the fatal like condition. Okay, and like the one of the treatment like naloxone, okay, can complete the reverse the effect of opioid overdose and prevent death due to the opioid overdose. So this is what I told you, like naloxone, all these drugs will be available for the treatment of this opioid. Okay, see, and like what is the opioids? Okay, so these opioids are the substance, as you know, like which are derived from the opium poppy or synthetic analog and all those things. Okay, and they have the potential to cause substance dependence, which is characterized by a strong desire to take opioids. Okay, and there will be a impaired control over opioid use, persistent opioid use despite harmful consequence, a higher priority given to opioid use than to other activities and obligation, increased tolerance, and a physical withdrawal reaction when opioids are discontinued. Okay, and dependency again on the prescription opioids include heterogenic dependency following the treatment of chronic pain and dependence following the diversion. Okay, so these are, and sometime what will happen, such a thing will be there, like so much what your addiction will be there, so they may lead to the theft of the prescription opioids from patient, medical facility, pharmacy, and the manufacturing and distribution chain. So this is what like opioid can lead to a person who have been addicted to this substance, when there will be a, after knowing there could be a harmful effect, but any hope patient who has been the addiction on this kind of opioid substance, so they may lead to the severe consequences. Okay, and there will be, as I told, like if there is a tolerate of that particular dose, so there will be a withdrawal symptom will be there, like which is not which can be observed via the physical reaction. Okay, so there will be an lack of like what you can say social uh, gathering and all those things will be there. The person will be always think live happy to be stay alone and all those things kind of thing will be there. Okay, so when any person who having the overdose, okay, so how the main part which is affecting due to the overdose of this opioid is brain. Okay, because like one of the brain, like they are giving the signal for the all our body activity. Okay, and opioid overdose can be identified by a combination of three sign, okay, and symptom, which are referred as a opioid overdose triad. Okay, so remember, opioid overdose triad, nothing but the three symptoms which are combined in a combination will give you identification that that person is on opioid overdose. So these are nothing but pinpoint pupils, unconsciousness, and respiratory depression. Okay, so these are the three symptoms which could be associated with this. Okay, so combining opioids with alcohol and sedative medication increase the risk of respiratory depression and death. And combination of opioids, alcohol, and sedative are often present in fatal drug overdoses. So if like we always tell, like if any person who having the diabetes, so there will be a comorbid disease also, like hypertension and all those things. So why I'm telling, if here Like along with opioid, if you are taking any person who are consuming alcohol or any marketed preparation like sedative or any drug, so there will be again like increasing the towards the death. Okay, that person will be increasing their life towards the death, and there will be a like respiratory depression also. Okay, so this is how a certain substance, like you can call this as a drug-drug interaction. Okay, and you can say it should be a drug-drug poisoning also. Okay, so this kind of symptom thing will be there. Okay, so there, like this opioid having their capacity, okay, to cause respiratory depression, and these are also responsible for high proportion of fatal drug overdoses around the world. Okay, and what are the risk factors which are associated for this opioid overdose? Okay, so many of people who are dependent on opioids are the group most likely to suffer an overdose. So any people, those who are consuming and those become the dependency on this kind of opioids, so they are the most sick. Okay, and the incidence of fatal opioid overdose among opioid dependent individuals is estimated at 0.65% per year. Okay, so those people who are opioid dependent, okay, so there will be an increasing risk of the fatal life condition. Okay, and people who are on the higher risk of opioid overdose, so people with opioid dependency in particular following reduced tolerance. Okay, like for example, uh, detoxification, release from like cessation of treatment. Okay, all those things may increase the chance. And like most of the time, if you what you can say, I can correlate with the some movie, like you have seen that many of movie like where they inject drug in their veins their self, like one movie like Urta Punjab, there, like Shahid Kapoor all. So there they going to inject the drug into their vein only. Okay, so you can see that person where like the area where they are injecting this kind of toxic drug into their vein, so that part become blackish. Okay, or like red, dark red and bluish color, because what will happen, because they are continuously administrating their the drug via the injection of this kind of substance, addictive substance may increase the, like there will be why there will be increasing the tendency for this intravenous administration, because what will happen, that person may having the craving towards this thing. Okay, so they want to see the immediate effect, or they want to get relief from this psychological thing. So they you as you know, like intravenous food having the highest bioavailability, so they can see the effect immediately. So therefore most of the time what will happen, they will go for this IV dose of this opioid or any kind of addictive substance, so they can see the effect immediately. So you have seen many of movies, like after giving the any of addictive substance via intravenous, they will sleep, or they will feel like calm and relax. Okay, so you can observe, and most of the North Indian state like Punjab and all those things, you can see teenager, okay, at the so there is the most difficult task for the government, like to control this what you can say, the controlling of this addictive substance thing. Okay, so this is the most targeting thing and difficult task for the country. Okay, is to control the this kind of substance addiction. Okay, and sometimes what will happen, some people will use, as I told you already, that prescription product and all those things. Okay, and household member of people in possession of influence. See, I don't know whether you guys or not know, in our side in Rajasthan mainly, that many of ruling rural area. Okay, there is a like you have seen many of type of culture. So we have in the rural area culture, like those people will go to anyone at their place to meet. Okay, so like especially old age group. Okay, old age people will go to meet at somewhere. So in in place of offering tea coffee, they will offer this opioid. Okay, so this is the one of the worst culture I have ever seen here in rural area of my state. So this is the one of the most common problem. Okay, here to control this kind of opioid poisoning thing. Okay, so this is what, like, people who got addicted, it is a very very worst part. Okay, so what could be the emergency responses to opioid overdose? See, what will happen? There could be a death, okay, and sometime there will be a respiratory depression and all those things will be there. So how you can prevent any people from the opioid overdose? See, so many of approaches will be there to reducing the prescription drug, okay, in general into the community, or there will be a specific measure will be taking. So like many of time there will be a best treatment, like you have seen that movie, what one, Sanju, in that they will send to the rehabilitated center, or here we can use the terminology detox center. Okay, detox center will be there will be a specific detox center, like those person who are on the severe addiction, so they need to stay like in-house detox and therapy will be there, and one person who are not that much for that out, not in-house. Okay, so in-house they will ask them to stay at least 8 to 12 weeks in that detox center, and they will give the therapy, like they will counsel that person nearly daily 4 to 5 times. And after once time goes over and that person become normal, they will not leave that person immediately. First they try to get that person to mingle in the social environment and mingle with the people and try to solve the puzzles and all those things. Once they become normal, they will leave them. Okay, the second, like non in house, like those person who are not severe addicted but normally, okay, addiction has been started. So for that people, initially what they will do, they will call that person weekly 3 to 4 times, and they will do the counsel. And once person will become normal, same thing, they will ask them to be a socially friend away and all those things. Then they will consider as after big few weeks, they will consider that person as a normal person. Okay, so these are the one of the therapy will be there, detox center. Okay, remember. And apart from that, there will be a like many of drug treatment are available, as I told you, naloxone and all those things. And most of the time what you can do the best thing as a clinical pharmacy, give the advice to less use of this kind of prescription drug. Okay, and any person who are having consuming this prescription drug, so always maintain the data. Okay, so and monitor them. Okay, and limiting the inappropriate over the counter sales of this kind of opioid substances. So these are the some of the precaution you always need to take care, like as a clinical pharmacist. So what could be the thing which are associated with this opioid poisoning? Okay, so this is what general introduction behind this opioid over poisoning. So I hope you understand here. If any doubt, you can ask me. Any doubt?
No, sir.
Okay, okay. Chalo, I'll stop here. Next class will continue. And before I leave, Arun, happy birthday.
Thank you, sir.
Okay, enjoy. Take care. Chalo, bye.
Thank you, sir.